I understand how challenging this can be for Canadians. The science is evolving as we get more and more data. Experts are refining and shifting their recommendations. Canadians need to know that every step of the way, there is one thing driving all these experts, and that is keeping Canadians safe.
Okay, so you got the circuit breaker going on in British Columbia, the curfews in Quebec, the shutdown in Ontario. These are desperate measures to control the virus because the vaccines simply did not arrive soon enough for this herd immunity. But even as they do finally arrive, there are still confusing messages about vaccine safety, specifically around AstraZeneca. Why did the National Advisory Committee on Immunization suddenly ask to temporarily stop using that key vaccine for people under the age of 55? Is that leading to vaccine hesitancy at a critical time? Let's find out. Joining me now is the Vice Chair of the National Advisory Committee on Immunization, Dr. Shelley Deeks. Dr. Deeks, thanks for your work. Happy Easter to you and your family. The NACI recommendation is based on a risk-reward, right? The risk that there could be a blood clot, and so temporarily pausing that for under 55. But the risk is so low, never happened in Canada, and now the danger of COVID is so high that I wonder now, with the variants of concern hitting younger people, 30s, 40s, and 50s, is it time to change that assessment and say, you know what, the risk reward now works, give it to anybody?
So we are actually in a fortunate situation in Canada that we have a suite of COVID-19 vaccines. And so what we have said at the National Advisory Committee on Immunization is, while this safety signal is being investigated, we should pause the use of AstraZeneca vaccine in individuals under 55 years of age. Both the other products that are currently available in Canada, the mRNA vaccines, so Pfizer and Moderna, can be continued to be used in this age group, and AstraZeneca can be used in people older than 55. There's
so much vaccine hesitancy at a critical time. We just approved, we just got 1.5 million doses of this. We've ordered 20 million. The UK has used AstraZeneca on tens of millions of people. They are confident. Health Canada says it's safe. AstraZeneca itself says it's safe. So what's the delta here between what the National Advisory Committee on Immunization is saying, we're so concerned, but the UK is not concerned, Health Canada is not concerned, and AstraZeneca is not concerned?
Well, Health Canada is collecting further information, so it's not that other groups are not concerned. There is a very different mandate for Health Canada versus NACI. So they are looking at an individual vaccine and how that product is licensed in a country. At NACI, we're taking a population-based perspective, and we are looking at this vaccine compared to the suite of vaccines. We are not the only country who has paused AstraZeneca use while the signal is getting investigated, and we very much may start the use again after the signal has been thoroughly investigated.
Dr. Deeks, how long will this investigation take?
Well, it's under active investigation in Europe. Health Canada has also asked AstraZeneca to provide a risk assessment in the Canadian context, and so that will be in a week or so. And NACI is going to be looking at all of that data, as is Health Canada.
Right.
And I think it's really important for your listeners to also think about the potential damages of a safety signal if we didn't act. And we have a couple of cases of this in Canada where we have young people dying, healthy young people dying after receipt of a vaccine. We do really need to weigh the benefits and the risks, and that might damage the whole COVID-19 immunization program, and we absolutely can't have that.
But they're not dying from the AstraZeneca vaccine, just to be clear to our viewers here. And then, of course, the ratio of how many people are dying from COVID. But, you know, all this messaging about AstraZeneca from NACI, first concern about over 65, now under 55, you know it's led to a plummeting confidence in that vaccine, and now real vaccine hesitancy. There are people who are going to write to me after the show and say, I don't know if I'm safe when I take it, I'm concerned about it, should I take it, should I wait for the other vaccines? Are you concerned that all these protocol changes are basically going to turn people off a very critical vaccine?
Yeah, I mean, the messaging has been evolving and it is confusing. It is a really challenging time in that we have vaccines that are coming online and we don't have a lot of information, and we're trying to be responsive and transparent to providers about the information we have. The clinical trials for AstraZeneca, when the product was first licensed, did not have strong data in elderly populations, which is why NACI recommended its use up until the age of 65. We very quickly got real-world evidence, and that is the normal case as vaccines are rolled out. As that real-world evidence came out, we changed the recommendation and indicated that people over 65 could use it. So, and then with the safety signal, none of us knew there was going to be a safety signal, but we've also committed to Canadians that we will, if there is an issue, we will be transparent and we will change our recommendations based on those issues.
Dr. Deeks, I got to leave it there. Thank you so much for joining us. I really appreciate it.
Okay, thank you very much.